I chose ophthalmology by accident. I wanted to do a surgical field, which is more challenging for me. So what I thought I'll do after my MBBS, but I did not get an opportunity to do a surgical branch at that time. So I chose an ophthalmology as an alternative option, thinking that I'll have more time to do more, prepare for another exam and things like that. But then when I joined ophthalmology, thanks to a few of my assistant professors who made me go deeper into ophthalmolozy, and they were actually doing retina work, so that made me understand more about retina. Then that gave me a perspective that retina is equally challenging when compared to any other surgical field. Everyday retina practice, there are many instances when you feel that you are helping people. Most of the retinal diseases are bilateral, and you see many times a patient sitting in your clinic where you have one eye lost because of some retinal problem, and you are dealing with the other eye and the only eye which is left. There are a few instances, like once when I was did a surgery, an endoscopic surgery for a patient who had severe eye injury, one eye lost and the other eye is almost lost with injury to the eye, and we did this surgery along with the change in the cornea and keratoprosthesis. And you could see that the first post-operative day the patient jumped with joy because he could not see for the past many years, and we did this, and then he was able to see. That those things like that would make you keep going, and these are the few of the typical situations which you come across in retina practice, and those are the ones which will need to continue doing retina practice. So what helped me in retina is that two of my main characters, that is patience and persistence. These are the two important things which help me to grow in retina, because once we are in the field of retina, it is not like a simple cataract surgery where we used to finish surgeries in 15 minutes, but whereas retina needed a lot more patience and surgeries used to prolong for a longer time. So we definitely needed a patience. That's something which has helped me a lot. And persistence is definitely another factor which has helped me a lot in retina, because many times the prognosis for retina surgeries is not that great. And if you tend to go to a situation where you start feeling, why am I doing all these things, and you have to get through that phase, you need to have a persistence, you need to keep trying. So then you will reach a stage where you will be in a better position to understand your own skills and results. So these are the two factors which help me a lot in the do good in retina. Yeah, I agree that life is a roller coaster ride, and especially in retina practice, you will always notice that even in a single day. So you see one patient where you have done surgery, it is done well, and the next room, if you go and start seeing the patient, you will see you would have seen a recurrent retinal detachment. That would get you down, and in the beginning it used to last for a few weeks, that if you see any recurrence like that. So that's when I had a difficulty, and I am sure that most of my fellows have come back and asked me this about the same questions. And that's when I actually looked towards my mentors and then asked them what and how to go about doing it. So one thing which they told me was, like, you need to look at your own results more objectively and do what you can while you are doing surgery, so that you don't have to think back and say, I should have done this. But when I looked back and started recording all my results and then start looking at the results overall, then I realized that yes, it's not just the that me being a bad surgeon or anything like that. It is basically how the results are, and you are comparable with anyone else. So that's what gives you a confidence that yes, you are good. That you need to have an objective assessment of your own results. It would help in improving yourself also at the same time, and it will give you a confidence to do what you are doing and what you are how you are treating your patients. For anyone who would want to do retina, I would say it's the most interesting field, and it has a lot of challenges to offer, and both in clinical and in research. You need to have a patience and persistence, like what I said in the beginning, and you will definitely do well if you have interest in retina and you pursue it with patience and persistence.